My name is Doug Griffin. I live in Newton, New Hampshire. I lost my precious daughter, Courtney, to an overdose of fentanyl on September 29, 2014. She was 20 years old at the time of her passing. I come today to represent the Addiction Policy Forum's families. My wife is here with me today. She is my rock and stands beside me in all that I do to fight this wave of destruction sweeping across our great land. Without her, I would never have been able to even attempt to begin the fight. At this point, we all know what a family faces when a loved one begins a life of substance misuse, so I want to focus today on what we face after we've lost the battle, and we must go on with broken hearts and broken dreams. My family story begins on the plains of Kingston, New Hampshire on a cold November morning shortly after Courtney's passing. We stood and told a small crowd of maybe 200 about our struggle and urged the public to learn quickly of the dangers of drugs in our communities. Shortly after that rally, our pastor, Aaron Goodrow, began a monthly service in our small church for those touched by addiction. Aaron has held 23 funeral services over the past 4 years for those who have died from overdose. My wife and I co-host the event and make a dish to bring to the potluck dinner after each service. It's there that we comfort the moms and dads, the grandparents, siblings, and friends of those new to loss. We try to help them learn to manage their grief and begin life anew. At that service, we fill blessing bags. These are small backpack-type bags we fill with toiletries and personal care items. They are distributed to those that are forced to the streets by their addiction. I am a Lion. And 2014 was the year our Lions Club was chartered. My wife and I and our 2 daughters, Courtney and Shannon, also joined the club. Courtney cooked scrambled eggs for around 200 people in our annual fundraiser about a month before her passing. Lion Mike Dolan and I pushed for the formation of a Leo's Club in the Sanborn Regional High School shortly after Lion Courtney passed. Leo's are junior Lions aged 12 to 18. Last week, our 21st member signed on. The Leos helped to set up a local community center and are raising funds to help build a safe place for teens to gather. When asked what they wanted to do as a club, they replied that they wanted to push drugs out of their school. I believe that the only way to get them out is because if no one's buying them, there won't be any reason to have them in there. We are hoping our sports teams will be the first in the state to pledge to be drug-free. Then the cool kids will be helping to let the students know there's no place for drugs in our schools. I have been selected as the Leo chairperson by the New Hampshire Lions, so I travel to cities and towns encouraging them to start Leo's clubs in their school. The Kingston Lions Club has begun an annual golf tournament with the proceeds being donated to treatment facilities and organizations helping those with substance misuse disorder. Our funds become scholarships to help people into treatment and to begin to put them on the path of recovery. My family owns the Green Griffin, a local flower shop, and my daughter Shannon is the world's best florist. Don't take my word for it. You can just ask anyone. The flower shop is the place where people come to talk about their sons and daughters with substance misuse disorder. It's not uncommon to have 2 or 3 families a day in there who eventually get around to talking about their kids. I am the man at your door with flowers the morning after your son or daughter has died from an overdose. I know how these people feel. Excuse me. And there's no worse pain. My daughter is sought after to do these flowers for these victims, having lost her best friend and sister. She always takes time to make beautiful arrangements for these families to help ease their pain. It kills me to see a tear in her eye while she works. My dear friend Anne-Marie Zenfagna has painted up portraits of over 100 souls lost to overdose, and there is never a fee for her art. I have seen her portraits of her daughter Jackie and my daughter Courtney side by side in many events in New Hampshire. I am on the board of directors of the Merrimack Valley Prevention and Substance Abuse Project in Massachusetts. I am there so I can help erase the border between Massachusetts and New Hampshire. There are no borders in this fight. We work to raise awareness across the Merrimack Valley to fight for legislation to improve conditions for the residents of Massachusetts struggling with the substance misuse problem. I was contacted by the Addiction Policy Forum a couple of years ago, and since then I have worked gladly and closely with that amazing team of professionals whose goal it is to save lives. Through the storm of this epidemic, Jessica Nickel has pushed hard to find ways to help others with their struggle. Now with a reach of approximately 4 million, and with thousands of families under her wing, she pushes forward to build a nationwide network of souls committed to a common goal, the saving of lives and the finding of a cure for addiction. I work with families every day, and each person is different. There are different reasons people take drugs, but what I hear most often is that they take them to feel normal and to fit in. Mental health issues lead many people to drugs where treatment and proper medication could allow them to live a normal life. Our daughter begged for treatment and told us repeatedly that she couldn't live this way. Our insurance company denied her at every door. The pills she found so easily at school led to heroin and the destruction of her life. I hear people say that it's their choice and they deserve what they get. Recently, I had a professional call me. He had hurt himself playing flag football one Sunday afternoon with his pals. The doctor prescribed an opioid, and after following the instructions on the prescription, he found he needed more. He learned that he was now addicted to them and didn't want to lose his job and ruin his career. What could he do? I'm sure this has happened to thousands across America, across the globe. Should this man be shunned or incarcerated? Our jails and prisons are filled with citizens desperately seeking a $40 bag of what they absolutely must have. There is no consequence they fear. There is only a hole that has to be filled. Without proper treatment, there will be no end to their agony. If any of you think they are injecting heroin to party with their friends, you are wrong. They are dying in gas stations, bathrooms, at the wheel of the car, while driving with their children in the car seat behind them, and alone in secret places that they hide from the world. I would find my daughter Courtney curled in a ball on her closet floor, hiding from the world. I had planned to retire next year to spend some time on a riverbank somewhere fishing while playing with my grandchildren. Courtney won't be having any grandchildren or children. And I probably won't be fishing. I will most likely be working with the Addiction Policy Forum and continuing their fight. Today, I come to speak for those seeking treatment in a world without availability, without insurance coverage, filled with stigma. I testify on behalf of those of my friends raising their grandchildren after the loss of a son or daughter. I testify on behalf of the babies born addicted to heroin and their moms fighting to keep custody of them. I am here today to speak for the treatment providers constantly being squeezed for fewer and fewer insurance days for treatment. I am here for the lost, homeless men and women at winter's icy breath soon blow through the streets of Manchester, New Hampshire. As the holidays approach and you are making your lists of who's naughty and who's nice, I pray your children will be spared from this plague and that you never know what it's like to be me.